So I dug into it, and I quickly realized that over 2/3 of the cost of every patient, let me put that another way, 66 cents of every dollar spent in healthcare is spent towards administrative activities.
Mm-hmm.
Unbelievable.
Mm-hmm.
So wait a minute. So this whole debate we're having about who's going to pay for healthcare and how we're breaking the system and how Medicare is going to, bankrupt the government and all of these things that we're talking about. If we eliminate the administrative burden, we're now at 1/3 of the cost. Really?
Mm-hmm.
Would it be possible to give everyone in the world healthcare? Right? All
Mm-hmm.
of a sudden, we'll start turning. And so I thought, okay, we can use the same artificial intelligence and augmented reality systems that we were using in the self-driving vehicle space to eliminate the administrative burden of healthcare.
Hello, I'm Paul Johnson. I'm here with the Optimistic American. My guest today is James Bates. He has a fascinating company. It's a company called AdviNOW that's involved in the artificial intelligence space. He's also kind of a professor type person. I've learned a lot from Jim over the years just trying to understand the artificial intelligence space. But in any event, Paul Johnson with the Optimistic American. We're here to talk about hope. James, welcome to the show.
Paul, thanks for having me. I appreciate it.
Oh, thank you for being here. All right. So for many people in my audience, they don't have the foggiest understanding of what AI technology is, or they think they know what it means, but they really don't understand it in depth. Help us out.
Sure. AI is one of the most over-abused terms in the media today.
Uh-huh.
I mean, everything is AI. You can't go to the grocery store without somebody telling you that AI is involved and you want to buy this. You want to buy any electronic equipment, AI is there. And you're like,
Yeah.
Well, what does that actually mean? What is AI? Well, AI is actually artificial intelligence is exactly what it says, but it's an overabused term, which we very seldom see today, but is in the world today. Okay, so what do I mean by that? Well, for somebody to actually have intelligence, you actually have to start at the very basic. What can that person do? Well, that person can actually reason. What does reason mean? Reason means that you're accepting outside data, you're internalizing that outside data, and you're making a decision. All right, well, that is the definition of basic intelligence. What's a higher level of intelligence? Higher level of intelligence is based off of that decision you made, you see the outcome, and then you adjust your algorithm, your reasoning, based off of what you observed. So now all of a sudden, as a child, you get up and start walking across the room when you're 2 years old, or whenever you start doing it, 18 months or so. You realize that if you don't basically balance yourself right, you're going to fall and that's going to hurt. Well, that is learning. So in the technology space, when somebody says AI, what does it mean? For old people like me, I turned 50 this year. So what?
Still a baby, buddy.
Still a baby. I'm feeling it, let me tell you. I hear AI and I automatically think Terminator, right? And here is going to be some big computer system. It's going to decide humans are the problem and destroy us all, right? Kill us all. Arnie, come help us. But ultimately, what AI really is and how it affects us today these are algorithms that learn about us. So if you start with a basic, and I'll just use Facebook because it's often abused AI example. When you are clicking through on a like or a dislike on your buddy's post or your friend's posts, or you say, wow, you click on a link and you start looking at that new Ford, truck that's for sale, it remembers that. And it says, okay, next time I'm going to show you a picture of that Ford truck. Or next time you clicked on birthday parties more than anything else, I'm going to show you more about birthday parties. And so the algorithm learns on its own and then starts showing the actual user more of what they were clicking on. Now, to us, we look at it and we're interested, and that leads a lot of addiction, and there's whole kinds of other conversations where that could lead to. But ultimately, you're reinforcing your learning. So all of a sudden, that AI algorithm has learned about Paul Johnson. I like birthday parties. I like Ford trucks, or whatever it may be. And so you get more of that in your feed. And so whatever you click on, that's what you get. Same thing happens with Google today. More you search about something, the more it's going to show up in ads.
So when they talk about machine learning, deep learning, and AI
Sure.
technology, what's the difference and does it matter?
It's very, very different.
Okay.
So as an example, my company, AdviNOW Medical, we use artificial intelligence to essentially mimic a physician's brain to know which questions to ask, which orders to place, and then which illnesses this patient likely has. Well, how do we start that? We started that by the AI reading a bunch of literature. So that is what you would call an expert trained model, because the AI read a book, a textbook, that is the expert. We actually hired experts to say, yes, AI, that result is accurate. And so we're setting a base truth inside the AI. That is artificial intelligence because it can learn. But other people approach it a different way. So maybe a competitor to AdviNOW, which is not as good, I'll just throw that out there. They would go, give me all your medical records. So, hey, I want all of your medical records, and I'm going to just look at what doctors put in the notes. I'm going to look at what they prescribed for patients with certain illnesses, and then I'm going to create a counter. So it's going to say, okay, there were 100 patients that were diagnosed with, let's say, COVID. 97 of those patients had a fever, right? 50% of those patients had a sore throat. 30% of those patients had, loss of taste or whatever it may be. And so the algorithm is automatically learning just by observing the data that, if you've got a fever, high likelihood, that's the highest likelihood. That is what is leading the conclusion that we probably have COVID. But then you have other strength things, but they're just a 30% correlation maybe for the loss of taste, which means there's 70 people that didn't lose their taste that also had COVID. And so the AI is learning the strength of each one of those correlations just by observing data. That means there was no expert involved. We just went in there, read the data, and it's essentially a counter. You count up how many times did you get this outcome with how many times you get this input, and you feed that, and that's what creates the initial version of the AI. Now, that is what you would call deep learning, where you go into a large data set and you learn it. Or then you could also go in and say, well, what is machine learned off of real data? And that's when you take the outcome of a model that you have now created and observe that outcome to see if it was accurate. And maybe you need an expert to determine if it was accurate. Maybe you use an algorithm. Maybe you're looking at outcomes. There's different ways to measure the accuracy. But then that comes fed back in. You actually change the values of the likelihoods, the correlation again between each one of those potential relationships to decide how your algorithm is built. Now, I'm going to try to say it in more simple terms because I've used a lot of math terms in that. It's just basically mimicking how your mind already works. So if you meet somebody that thinks they have COVID, you're going to go to them and say, oh, you know what? My mom, when she had COVID, she had a terrible fever, her joints ached, and she lost her taste. So we went, she got tested, it was good. But you know what? My sister, when she had COVID, she didn't lose taste. And so, but she did have a fever. And so when you start meeting someone and you're asking, do you have a fever? Automatically in your mind, you're doing that pattern match and you're saying, okay, I'm diagnosing COVID. That's exactly what the AI does as well.
So I've heard it described as data, knowledge, understanding, and then wisdom. Do you agree with that? Are those the levels? And if so, at what stage are we at today in AI technology?
That's a good question. We're definitely not at the knowledge level. It's going to sound terrible, but I would say we're still at the data level.
Really?
In general. Yeah. So I'll use healthcare as an example since that's where I'm from.
Yeah. Talk a little bit about AdviNOW.
Yeah. So what AdviNOW Medical does, right? Well, I'll tell a little bit about my background and then I'll jump into AdviNOW. That'll explain it a little bit better. So I've personally been in the high technology field for 25 years, a long time. Most recently, before AdviNOW, I had the opportunity to run a billion-dollar business in self-driving vehicle technologies. So we made the technologies that people like Google or Tesla on the startup side, or all the large guys like GM or Daimler or Chrysler, what they used to give the car the ability to sense the world around you, make decision, and then take actions, whether it's to brake or to steer. Everyone's familiar with Tesla. Believe it or not, a lot of other people have the same tech. It's just not turned on. Elon's a little bit more bold than the other car manufacturers. But how do I take my hands off the wheel and have the car still know when to brake or to steer? How can I follow the lines on the road? All of these things. That's the tech we made, and it was wonderful. I really enjoyed it, but we sold the company. And as an officer of the company, it was a good time for me to retire. And so I retired, and as goes with many retirement packages from an acquisition, I had a 2-year non-compete, which meant I couldn't do anything in that space. So I was left with nothing to do. I could play golf for 2 years, which I like golf, just not that much. Or I could do something better. And I looked at the world. This was 2016, and I thought, what is most broken? Well, if you all remember the 2016 times, it was a big rage about what a lot of people called Obamacare or the ACA. Should we approve it or not? And single payer systems and multi-payer systems and all of this huge debate. And I looked at that and I'm like, you know what? Healthcare is the most broken. So I will go ahead and just buy some medical practices. I figured I'll buy some medical practices and figure out what's wrong with it and learn. Well, it didn't take me long to realize when I started looking at the P&Ls and balance sheet, I started looking at the financials and the profitability of these clinics. I was looking at urgent care and primary care mainly at the time. That they weren't really profitable businesses. They are tough businesses. And if you're in that business, boy, you've got either a very, very thick skin and you love the people you work with or you're selling, right? It's really those two options. And so I took a step back and I thought, wow, at 3% profitability, which was the average of the people I looked at, 50% of clinics I looked at weren't making any money. At 3% profitability, I might as well buy a government bond, right? I'll make more money from the government than I would.
More secure.
And more secure than jumping into the world of healthcare. But I was intrigued because this has to be a solvable problem, right? I mean, we can't just say it's broken and there's nothing we can do. Then you end up with, the bipolar conversation we have today, which in my opinion is useless. And so, okay, let's find a solution. So I asked a friend that I made during this process if I could get involved with their clinic operations. And I just came in and pro bono. I didn't pay me a salary, but I just became a fly on the wall and just kind of dug into why can't they make more than 3%? And this specific clinic chain, they believed they were well run. They're like, hey, we're efficient. The guy was showing me all these metrics about patient satisfaction and doctors, return patient. And I'm like, all these metrics are awesome, but you're making 3%, right? Something has to be wrong. So I dug into it and I quickly realized that over 2/3 of the cost of every patient, let me put that another way, 66 cents of every dollar spent in healthcare is spent towards administrative activities. Unbelievable. So wait a minute. So this whole debate we're having about who's going to pay for healthcare and how we're breaking the system and how Medicare is going to, bankrupt the government and all of these things that we're talking about. If we eliminate the administrative burden, we're now at 1/3 of the cost. Really? Would it be possible to give everyone in the world healthcare? Right? All of a sudden, we'll start turning. And so I thought, okay, we can use the same artificial intelligence and augmented reality systems that we were using in the self-driving vehicle space to eliminate the administrative burden of healthcare. And so I was stupid enough to think it was easy. So I jumped in and did it. And that was 2016. And so what AdviNOW does is exactly that. It's a whole digital automation platform for patients and doctors and clinics across the whole gamut from the beginning to the end of the patient experience. We use artificial intelligence to ask the patient all the right questions, place all the right orders. And you compare that to what you do today. The doctor, you'd schedule an appointment with your doctor. You walk in the waiting room, you wait there for 30 minutes. They call you into the back room. You'd have a medical assistant, very nice person, come in and take your vitals, ask you why you're there today. Then they room you, right? Or they bring you to an exam room. Once you walk into the exam room, the doctor comes in, asks you all the same questions that the medical assistant asked you previously, and then decides, you know what, we need an x-ray, or we need a lab, or we need this measurement. And then the doctor says, I'll be back later. In comes a medical assistant again, helps you go get your radiology or go get your laboratory, whatever you need, and then puts you back in the room and you're twiddling your thumbs until the doctor, till the results are ready and the doctor comes back in. You're now an hour into this. 30 minutes in the waiting room, 30 minutes in the back room. And the
Not
doctor,
counting driving time.
Not counting driving time. And the doctor comes in and says, well, it looks like you probably don't need to worry about it. Go home, take some aspirin, right? And you're like, was that worth a visit to the doctor? So AdviNOW, you start on your phone, you get a link that's either sent to you or you click on the link on the website. You do all your registration from home. The AI will give you a chatbot experience to ask you all the questions that a physician's going to ask you up front. Then it will tell you, go get these labs, go get these images. All of that happens up front. So by the time you see the physician now just has all the data they need to make that conclusion. AdviNOW is not a diagnostic tool. AdviNOW is a data collection tool for the provider. And once the provider's looking at the AdviNOW solution, they're looking at a list of potential illnesses that are pattern matched to the symptomology that the patient had previously. So if you have an x-ray, you would have the x-ray results picked there, and that's going to rank order, hey, this person most likely has a broken arm, or it's going to rank order, this person has strep throat, or whatever it is, based off of the symptomology that the AI interviewed with. So the doctor then is just confirming, hey, this is what I'm seeing. When you said your throat was a pain of 6 out of 10, did you really mean it, right? Do you know what 6 out of 10 means? And the doctor is confirming with the patient, looking at the patient eye to eye, building that relationship, which in medicine is so important for the patient to be able to trust, what the physician is saying. And now that on average 3 minutes, according to the American Medical Association, average of 3 minutes in an urgent care a physician spends with a patient, that 3 minutes becomes valuable. And the physician now has a relationship with that patient. They're explaining to them the justification for the diagnosis based off of the objective and subjective information. So that is the questions and the labs and the results, everything they collected. And the patient's happy and the doctor's happy.
Now, there are other problems, obviously, in the
Totally.
the patient care business. The billing, the 85,000 CPT codes. What we've been in the primary care space for a number of years. Maybe you can tell me how AI technology is going to help in these areas. What happens from a billing standpoint is a patient will call in and they will say that they need to come in and get something done. When they come in, we have to get a pre-authorization from an insurance company. After they give us a pre-authorization, we have to go fill out a billing that has a code in it, one of those 85,000 CPT codes. About 30% of the time you're wrong, even after you spent time filling it out. You send it back to them. When you get done sending it back to them, you have about 50% of those come back to you a second time. You also have to collect a co-payment and a deductible as part of the process. And then when you get it all done, it's possible 3 or 4 years after you're done, you could end up getting an audit and a recoup where they say, hey, you didn't fill out the form correctly, you didn't fill out the CPT code correctly, you didn't write down the amount of weight. We want to recoup those dollar amounts back from you. Our estimate is that about 40% of the money that we had in the fee-for-service portion of our business was spent collecting our money. Just collecting our money, not the administrative costs, collecting our money.
And that is absolutely huge. The beautiful thing about AI, right, is that it doesn't make mistakes in terms of matching, right? Can it make a mistake in terms of diagnosing all day long, right? I mean, it's not infallible, and anyone who tells you it is lying to you. But what it can do is choose the right CPT code given what the entries is. It can make sure that that form is filled out correctly every time. In fact, it will fill out the form for you.
And better.
What it can do is make sure that that pre-auth is done before you spend any money, so you aren't losing money.
All right, so let's separate these two, the diagnosis component and the administrative component up front. What percent of doctors you think are utilizing any type of AI technology today in the administrative portion of their business?
Almost 0%, only our physicians.
Only 0%. Okay.
Yeah.
And
Only the ones that use our platform.
all right. And so having that portion down, you have to be exceptional at. Now, your business, are you actually a clinic, or are you a business that sells product to a clinic?
Yeah, so we're a business that sells product to a clinic. We are not a clinic. Our customers are clinics, they're hospital systems, and even some insurance companies. So the people who do medical encounters or have medical visits with patients, those are the people who use our platform.
All right. So rank today, if you would, your administrative process versus your diagnosis process on a 1 to 10. What would you say you are on a 1 to 10? The administrative portion of your business, being able to help doctors deal with all that administrative portion I said a moment ago.
10.
All right. Diagnosis, how would you rank it?
So I actually tie those together.
Okay.
And so let me explain what that means.
All right.
AdviNOW is not a diagnostic company. We are not going to diagnose what disease. What we do is collect the data that a doctor needs and then do all of the documentation and justification that a doctor would need to do to choose a diagnosis. So,
and do you give them options, or do you just give them data?
We give them options.
Okay.
So we go up and we'll use a sore throat as an example for a patient. They go in, they have a sore throat, and the AI interviews them, takes images of their throat, gets heart exam, lung exam.
How much of that can you do at home?
You can do all of it at home.
Okay.
Now, the measurements piece, you do need equipment. The equipment is used at home, so it can be used at home. It's roughly, if you include all of the features AdviNOW has, is $1,000. But if you don't want a stethoscope exam, which those are $450 just for the device,
right?
And you don't want a throat exam, and for the otoscope device, or not otoscope, but laryngoscopic device, that's about a $250 device. Those are the expensive ones. Everything else, even an ear exam, or you go through you go through a blood pressure, pulse ox, all of that stuff can be done at home for $100.
Do you see wearables starting to tie into that?
We do. We do. We have multiple clients that come in and say, hey, we're getting all this data sent to us from Apple, and we have no idea what to do with it. AdviNOW, can you help us? So what we do in those instances is, again, because we're not able to diagnose, we are not approved by the FDA to diagnose. We work with our clients to set thresholds. Well, what does that mean? That means a patient's going to check their blood pressure every day. And normal, 120/80. Let's just say that that's normal. And this patient is at 130, 140, and you start to see it climb. And then you say, well, maybe that's bad, but it's okay. Maybe Lipitor, well, let's figure out what we're going to do with this patient. But then all of a sudden you see the bottom half start jumping up to 90 to 100. You're going to set off different thresholds in the algorithm on what this patient needs to go do. So if a patient's being remote patient monitored, which is what you would call that, for hypertension, which is the example I was giving, then if the systolic started to move dramatically, which the bottom portion of your blood pressure starts moving dramatically, you actually have to go get labs, right? They'll want to ask a whole bunch of different questions, and then they'll want you to come in and see your physician. And all of that will happen automatically now without the input of a human. And this is where that's really not AI, that's administrative.
Okay.
It's really just checking, hey, do we have something out of bounds?
All right. So on the administrative side, you said it's a 10 out of 10. What does it take to scale that? What's it going to take to get other clinics to start to use it? Is that a sales force challenge? Is that a capital challenge? What are the challenges that are ingrained in being able to scale this?
Yeah. So it's interesting. I come from outside the healthcare industry, although 6 years into it now, I feel like I'm embedded in the healthcare industry. The healthcare industry does not respond to normal economics the way other industries do. So I talked about the profitability of clinics. Those clinics that are smaller chains, that's where they live at from a profitability standpoint. You can get out of that to roughly, 9-10% profitability if you're at very large scale. But ultimately, that's the world that you live in. When you go to somebody and say, you know what, I can make your 3% profitability 35%. which is what our product does for them.
Mm-hmm.
And you'd say, I can do that for you, but you are going to have to help me integrate into your electronic medical record. You are going to have to initially pay a fee to do that. All of a sudden people are, they're like, okay, well, does, who else uses the platform? And like, okay, well, here are these 5 guys. And then like, okay, but we're, this little bit different because we're special.
Right.
I'm like, okay, so everybody's special. And the problem with healthcare is everyone thinks they're special, but most of them aren't really special. There are some people who are special, but they're the exception, not the rule. But in everyone's mind, they think they're special.
I would imagine one of the challenges with what you just said, though, is that oftentimes a doctor being able to understand how to dig into his electronic medical records to make the changes he sees as being insurmountable. He thinks he can't do it.
Absolutely.
All right. So how do you fix that? How do you
So
help
what
them
we've
with that?
done, yeah. So this has actually been, again, you asked me what the biggest bottleneck is. This is it, right? What we've done is we've gone through and integrated into some of the major electronic medical record systems that are out there. Now, for you healthcare people who are listening to this, and I don't know, how many people's eyes are glazing over right now, but there's 2 major electronic medical record systems in hospitals. One is Epic and one is Cerner. And they own 80-90% of the hospital space in the United States.
In the electronic medical record
in the
space.
electronic medical record space.
Explain what an electronic medical record is to people who aren't in the healthcare space.
It's just a database that stores your medical information.
Okay. And there are 2 major companies that help doctors or hospitals do that.
Exactly.
There are more, but there are 2 majors.
There's 2 majors. But that's in hospitals. Once you leave hospital systems and then you get into the smaller clinical space, there's about 200.
And they don't always integrate.
None of them integrate. Don't always is definitely, a little bit kind to the results.
I watch it happen all the time. To get data back to people, they're sending it on a fax, a paper fax. I didn't even know fax machines existed before I got back into healthcare.
Exactly. It's just absolutely crazy. It's like you've gone back in time 30 years. But that's the reality is they don't. So AdviNOW actually had to invent a whole different technology around integrating with electronic medical records. And we've probably spent, I would say, out of all of the money we've raised, and we've raised $20 million. I mean, so we've put a lot of money into this entity. I'd say probably 25% of it. I haven't done the math exactly. So, for you auditors out there.
That's probably hard too, also, because you're trying to figure out what portion of somebody's time and engineering was spent on doing X.
But we had to invent a way to integrate arbitrarily into any electronic database. And so that's a key part of our technology and in some of our largest engagements. And I can say that 4 out of the top 10 hospital systems in the United States are integrating with AdviNOW. You can look at 3 of the top 5 pharmacy systems that also do healthcare clinics are also integrating with AdviNOW right now. So we're having some great success with the big guys. But getting that success and being able to do it, that integration, every single one of them wants something special. And they store their data differently. Same system, say 2 companies use Epic. It's not the same. And so we had to invent a whole process that would integrate with all of these different guys, take on the different nuances, and be able to do it in a scalable way.
Okay, so I've got to walk through the entrepreneur side of this for a second. So you leave being involved in the AI space in driving, and you say, "Oh, healthcare, there's a problem. I want to get involved with it," and you think you find the solution, which is I'm going to help them administratively drive this. But every time you turn around, there's another problem. There's another thing you didn't know about the healthcare space that you have to figure out. How do you deal with that? I mean, you raise money to deal with problem A, and all of a sudden you have A, B, and C problems that you have to deal with.
So, yes, many times if you ask an entrepreneur, if you knew what you knew today, would you still do it? Right?
Yes, but I'd have saved a lot of money.
Yes, but I would have saved a lot of money is the right answer. It's really interesting because if you knew everything you would have needed to know, then the problem wouldn't have existed. And what was interesting to me is when I first came up with this idea of automating the medical encounter, completely automating the visit from the beginning to end, essentially having an AI scribe for the physician. If you really dumb it down for the medical professionals who are listening to this, it's an AI scribe, right? Basically, it's like having a physician assistant do all your documentation and coding for you and present it to you for review. And so I thought, hey, this is a great idea. Everybody wants to do it. Why wouldn't you want to do it? So initially, I first thing I started to do is setting up meetings and networking into major chief medical officers, or doing stuff like that. And what I realized is that they don't care if they're profitable. And so, I can't name them. I guess I shouldn't name them.
No, you shouldn't. But it's
there's
okay.
one system that told me that.
Yeah.
I mean, they flat out. We don't care how much money we make. That's not incentive for us, James. Why should we use you? And then I said, well, providers will have less burnout. Doctors will have less burnout if you use us, because the number one leading cause of burnout is all the documentation doctors must do.
And when you join a hospital, it gets 10 times worse. And doctors are being forced into joining hospitals because they can't deal with all the regulations.
Exactly. And so when you look at that, you'd say, okay, so AdviNOW, so when I go and I market to a non-for-profit hospital that doesn't make any money, and quite frankly, they never want to make money, then you sell it as this. Well, I didn't know that at first. So there was a lot of times where somebody looks at that, and the responses I get are very interesting. I'd say from the foundation of the company, I've never presented the solution to a physician that said, this is not the future of healthcare. I can't think of one. They look at it and they say, something like this is the future of healthcare. Okay, great. Will you use it? Well, I'm kind of busy right now. I'm like, well, wait a minute. I thought you said this future. They're like, yeah, this has to be the future. What we're doing today definitely doesn't work. And this looks like a good idea. And I'd say, okay, well,
it's
use it.
The problem that you're on, I mean, our business very well at Redirect Health. The only way we figured out how to fix it is we had to own the whole thing.
Yeah.
We had to be able to control all of the different steps, because if we had to deal with one outsourced group, it was a challenge. Now we're not doing anything in AI space other than what we've done with you, but still owning the process becomes such an important part, because the traditional answer by providers is, that's not what I do. And nor are they necessarily always driven by profit. Because oftentimes their view is, no, I save people's lives. That's what I do. That's the role that I play in life. Now, sometimes they make very good money doing that. But in my experience with a lot of providers, usually when they make a lot of money, it was by accident. it was kind of the space that they went into and they made it work. Their business skills weren't really exceptional.
Exactly.
Their doctor skills were great.
And that was something that I came as a surprise to me. I did not realize how brutally true that statement you just said is. And so I had to completely change how I sold, how I would sell to a CEO of a chain of clinics that does care about the profit, because he was pulled from outside the industry and he was hired by some private equity firm to make this profitable. And then how I sell to the chief medical officer, there are two different slide sets. There are two different pitches. There are two different ways to approach it. And being ignorant, which I was very ignorant in the early days, that's for sure. And I'm still ignorant today in a lot of areas, but a little more knowledgeable.
By the whole nature of being in a startup means you are going to be ignorant of a lot of things.
Meant that I didn't really get my message out to the people that needed to hear it first. So my first approach, pre-pandemic was, I want to sell, because selling to these hospital systems is so hard, because they don't really, the guys who get it can't push it through. And the guys who don't get it, tell me it's the future, but they're like, I've got something else to do right now.
How does this make a difference in the average person's life? When you get done doing what you're doing 5 years from now, where does this really make a difference in the average person? I mean, what I hear from most people is, hey, AI technology helps Google, it helps Facebook, but I don't see how it's going to have any effect on my life. How do you see it affecting their life?
I'll just use one metric in healthcare. Today we have a 50% shortage in primary care, which means 50% of the U.S. population cannot find a primary care doctor if they wanted to. So it's a numbers game. There's not enough doctors. Why? Because people are retiring out of primary care and they're not moving into that space, right? So that's problem number one. Then you'd say problem number two, 5%, and these are interesting metrics, 5% of adults less than 30 actually have a primary care doctor. Well, what does that mean? They don't want one. They don't see the need. Why should I have a primary care doctor? All right. So you have these two dichotomies, which are really upending the whole healthcare system. And it's adding a lot of cost to people who don't take care of themselves, right? What AI does for all of this is to solve the problem of there's not enough doctors. Physicians who use our platform actually see 2 times more patients per hour than the ones that don't. Now, if you tell a physician, this is one of the problems I made early on, hey, you get to see 2 times more patients, they're like, no way, I don't want that, right? I see 3 patients an hour, that's all I'm going to do. You know, no one in hell is going to have me seeing 6 patients an hour, right? But when you say, well, what if I gave you a physician assistant that did all your documentation, all your coding, everything for you, and you just saw patients all day?
You were just doing doctoring.
You were just doing doctoring. Could you see 6 patients an hour? Oh, yeah, well, I can do that.
Yeah. In fact, I find that as you know, in our process, we've resolved it by administrative assistance as opposed to AI technology. But what we find is that those doctors who are doing more patients are actually more satisfied because the things they're doing relate to the highest level of their licensure.
And that's what they love. They love working at the top of their license. They don't want to be the guys to write in the EMR. They don't want to be the guys to choose the code. I mean, they don't want to be that. They don't want that job. They went to medical school to treat patients, connect with patients, be an impact in patients' lives. And AdviNOW allows them to do that again. So not only do we resolve the numbers problem with primary care, but we also allow physicians to enjoy their job again. So what do patients get out of it? Patients get shorter wait time to see the doctor. What do patients get out of it? They get a more responsive physician to the data that they have. They get a physician that actually listens to them instead of the patient talking to the back of their head as they're typing into the electronic medical record. These are results that they actually see. Now, if you look at the problem on the other side, 5% of adults less than 30 don't have a PCP. Well, you can now connect all of the data together and proactively reach out to patients who need care.
Or help them determine if they needed care.
Help them determine if they need care. And then if they do, make sure that they get it from the right physician, right? And I'll just use an example of some friends of mine, right? I mean, over COVID, I had a friend of mine that I grew up with in high school. She got COVID. She went to her local urgent care, and the local urgent care doctor said, yep, you've got COVID, gave her the test, you got COVID, go home. And so she did, and she died. Now, is it that doctor's fault? No, I mean, he sees 100 patients a day during those times, right? I mean, she died. Why did she die, right? She died because the right data wasn't collected. But that physician, there's no way that physician who during COVID times, they were seeing a crazy number of patients. There's no way for that physician's going to know.
And we were seeing them in parking lots with
it's just crazy.
With lines of cars behind them. I mean, it was a dramatic shift.
And she just showed up and she said, hey, and loss of taste, and the physician asked the right questions, which do you have shortness of breath? I mean, but when you take it into account, combined with her heart condition, which is ultimately she ended up dying from a heart attack, which was exacerbated by the high blood pressure and the actual impacts from COVID. If you put all of those data sets together, all of a sudden you would know how to treat that.
You'd have a different diagnosis.
You'd have a different diagnosis. Well, same diagnosis, COVID, but you'd have a different plan associated with that COVID.
So, so healthy conditions, certainly that's one of them, helping relieve the stress of not having enough doctors. But the thing that you skipped over in there very quickly that I think is the biggest issue technology is going to give us is time.
Totally.
Right. It's the drive that you have to take to the doctor, the time that you're sitting in the lobby. The most valuable thing that we have as individuals is our time, the time to spend with our children, our grandchildren, with the people that we love, to go fishing or to go hiking or to do all these other things that make life so much richer than sitting in a lobby. All right,
Absolutely.
lobbies just are not exciting places to be, which I've always been interested in why insurance companies try to drive people. There are lots of policies that try to drive people to go to in-person visits, as if they think that people must really dig hanging out at doctors' offices, and they'll do it a lot more if you don't create some types of restrictions. But what that time gives us, I looked at a number the other day. A mother of a diabetic child spends 16 weeks of her year focused on that child, right? Why? Because she's driving to doctor's visits, because she's having to deal with things in person that oftentimes
don't need to be done there.
Don't need to be done there. And technology can really dramatically change that. Okay.
Absolutely.
So I know you've made a big investment. I know that you've risked your reputation, you've risked your name, you've risked your money, you've risked everything that you have to be able to go into this venture.
Yes.
Right? Why? Why did you do that? And maybe more importantly, before you get to why, do this for me. Tell me your darkest day. Tell me what it felt like in that darkest day, and then how you got up and kept going.
Darkest day.
Everybody in business has that day where they're going, I don't know if I can pay payroll this week. I don't know if I can pay my rent this month, right? That you're worried about, is this sale going to happen? But there's always a day, even with the optimistic amongst us, which entrepreneurs are almost always optimistic, that you were in a way wondering whether or not it was going to happen. Tell me about that day, what it felt like, and how you got through it.
Yeah. So, I would have to choose 2020.
Okay.
It's pre-pandemic. We focused almost exclusively on retail medicine, and we chose retail medicine because they were the
What does retail medicine mean? I'm sorry to interrupt you. I want to get this to
So if you think of CVS, you have a minute clinic inside the CVS.
Okay.
So this is a traditional grocery store or a pharmacy that has a clinic attached to it, right? And so you can walk in and you can see patients. A lot of retail centers, grocery stores, and pharmacies are trying to put urgent care or primary care centers in their facility to drive patient traffic. They're trying to compete against the Amazons of the world, right? And so they're saying, we need patient traffic. We want to create the relationship with the patient, and putting a doctor here is the best way to do it. Okay, great. As people are going online for all their purchases, they still need to go show up at that location, and that's going to drive foot traffic. They'll buy something, they'll see the doctor, they'll win. Well, I believed in that hook, line, and sinker, right? 2019, that's when we released our product for commercial use. And I was lucky enough to sign up very, very large clients in the retail space. And we had commitments for literally thousands of locations that were going to be using AdviNOW. So as a startup guy, I go and raise money. I tell my investors all these promises, hey, we're going to go from 0 to $500,000 to $10 million to $100 million of revenue.
We're scaling, baby.
We're scaling. I'm burning through cash like crazy, preparing for all of this.
Yeah.
And then COVID hits. And the first thing the retail stores do is close down all of their healthcare operations. Why? Because running a clinic is ancillary to their business. What is primary to their business is keeping that pharmacy open. What's primary to their business is keeping that grocery store open. And they don't want sick people in their stores.
Okay, how do you find out about this? Did they call you?
They did.
What was the call like? Do you remember the first time you got called on it?
So the first time I got called was a call that basically, this was end of March 2020. And they're like, look, we don't know what's happening here because it was still very early in the pandemic, but, all of AdviNOW is going to stop. And we had only deployed in one of these 3 very large chains, retail chains. And that center called us and said, look, we're going to temporarily close all this stuff. We'll probably open in 3 months from now. And I'm like, we can survive this, right? Not a problem. These very large guys that were in the middle of EMR integration at the time also came to us and said, we need to pause this because we have a no travel rule and we have to do a security audit and all these things that are part of onboarding a large client, right? They
hmm
normally have on-site visits, and they're like, we need to pause all this stuff, and just 2 to 3 months, James.
hmm
Just until May or so, until COVID's over. Then May comes around, and then it's another 2 to 3 months. Then August comes around, and this is kind of where you get to the darkest hour, if you will.
Yeah.
And so I'm burning through cash like crazy, and I start, letting employees go and all kinds of things that are very tough in business. And then August comes around, and all three of them said, we're closed indefinitely.
Wow.
Now, all of them say very nice words. Oh, we're very interested in AdviNOW. AdviNOW is part of our corporate plan. We don't know how to scale without it. But this COVID thing, we have no visibility, and all we care about right now is testing and vaccinations. And so I was like, wow.
So
Here's my whole revenue stream.
do you remember where you were when the wow happened?
Oh, I was in my office.
You were in your office?
Yeah.
By yourself?
No, we actually all went back to work in June of 2020.
Okay.
In our office. Our office is, I'd let go enough staff by that time that we were well socially distanced within our office.
And so you, but when you're first getting to the wow, it's coming from a phone call or something where you're talking to someone. You have to go tell other people.
So yes and no. I
Mhm.
mean, there were two of us involved in the business side. We're
Mhm.
still a pretty small company at the
Right.
time. Actually, three of us. At that
Mhm.
time, there were three of us involved in the business side. And so we definitely sat and were like, what are we going to do?
Yeah.
But you got to keep the rest of your staff motivated. And if you go tell them that basically every single one of our revenue generators is now zero for the foreseeable future, and by the way, we run out of money in 3 months,
I have
it's not a good message.
I mentor young business people, and one of the things I tell them, I try to give them metaphors for who you're going to be as an entrepreneur. And one of the things I tell them is you're a shock absorber. I said, your employees have all the same risks you have, right? But if you go in there and tell them all the same risks, they won't be your employees anymore, right?
They don't understand.
Right. What they want to do is they want to get up, they want to go to work, they want to put in their 8 hours, and they want to go home and spend time with their family, and they want to be left alone. And they don't want to be worried about it. So you're the shock absorber that makes certain that everything is okay to them so that the organization can keep moving forward. And I've done that. I brought in Nerf footballs when I was at my most upset, just to try to get everybody to lighten up and to recognize life keeps moving on. But whatever it takes to get people motivated to move forward.
Yeah. And
how about the money side, the people who had invested? Do you have to call all of them?
I did. I had to have an investor update.
Was it hard?
Oh yeah. I mean, luckily, the pandemic was external.
Mm-hmm.
So,
you're right. It gives you some buffer.
It gives you a buffer.
Mm-hmm.
It's not, I had all this business and we lost it because we suck, right?
Mm-hmm.
That's a very, very bad message.
Uh-huh.
That's when investors are like, okay, do I need to sue you? Did you lie to me before? I mean, all of these very, very bad discussions come up. In this case, the pandemic was a buffer. So I didn't get anyone yelling and screaming and threatening and all of that stuff.
But they're stressed too, because this is their hard-earned money that they have invested.
But they're stressed.
Mm-hmm.
Absolutely.
Mm-hmm.
I mean, I promised them that we would, what was the original forecast going into 2020? We were going from like 300,000 that we did in 2019 to about 4 million, I think, in 2020. And now I was going back to them and saying, it's not even going to be $1 million, right? Our revenue is now zero, and we're in July.
Oh my gosh, yeah.
And it went down to zero. It ramped down to zero, and we're in July.
Yeah,
right.
And so, again, for most people, your revenues went down. That didn't mean that your burn rate went down necessarily.
No.
You have a high burn rate because you're trying to keep things moving and moving forward. Okay, so you start to navigate through this dark period.
So absolutely. And the first thing I do is you got to have clients, right? It doesn't matter what great products you have. If you don't have somebody using it,
people have to buy it.
Doesn't matter. And so I pivoted literally 100% of my time. Well, actually, I was working probably 14, 16-hour days at the time, where half my day, which was an 8-hour day, was making sure I was able to find new investors who are willing to bet on it, because all my current investors were feeling a little bit burned.
Yeah.
Right. And so we were going to run out of cash here pretty soon, and I needed to figure out a path. And then the other 8-hour day was creating a marketing plan, reaching out to clinics, reaching out to people who are interested. I mean, before the pandemic, we were very selective on the clients we would engage,
Uh-huh.
right? I, I, I had a lot of people who were wanting AdviNOW, but I wanted to go big with
By the way, let's
these
talk about
big
this
guys.
marketing plan. You're creating a marketing plan to basically tell yourself who you need to start calling. Is that correct?
That's
Uh,
and the amazing thing is, within 2 weeks, we had a client.
wow.
A nice large client that
Mhm.
was interested and ready to sign up. They had 50 clinics, and it was just
Never quit.
never
Never
quit.
give up.
But those 2 weeks were dark, and they weren't. And that client was not paying me.
Uh-huh.
You know, I had to agree to do the integration for free and all of these other things. You know, because they were struggling. Because of course, early in the pandemic, clinics did
Yeah,
not
they weren't
do well.
taking advantage. They're an early adopter.
Yeah,
They need to figure it out too.
exactly.
Yeah.
And so it turned out to be a very good experience for us and them, and the product matured dramatically. And it was enough for me to go raise money because we now had a client on the hook that people could call and talk to, and, you know, and it ended up working out, but it was a very, very interesting time.
Yeah.
That's for sure.
And would you, in looking back on it, do you believe that the strongest steel is forged by the hottest fire? Do you think it helped you?
Oh, absolutely.
Yeah.
You know, my career has been very interesting. Just not to waste too much time on it, but out of school, I graduated with a graduate degree in electrical engineering. I joined Bell Laboratories, and for old people.
By the way, no money. You didn't have money when you
Oh,
graduated
no.
from college.
No,
Your
I was
parents didn't give you
poor.
$1 billion. Okay,
No,
right.
I didn't have a Trump. Oh, my dad just lent me $5 million. You know,
Yeah.
that wasn't there. I was very poor.
Uh-huh.
And my wife was pregnant when I graduated,
Uh-huh.
and I got a wonderful job at Bell Labs, which was one of the premier research centers in the world. Right? They invented things like semiconductors. They invented radar. All of these things that were very, very. This is AT&T, as an entity, had a core research, kind of like Google today.
Uh-huh.
And I as a technical guy, I joined them, and I was really excited. It's my dream. Right.
Yeah.
Oh man, I've made it. But within 3 years, I transferred over to business, and I was lucky enough to take some classes at Wharton and kind of learn how to transition from engineering to marketing.
Uh-huh.
And so as an engineer, that's how I approach everything. And so after that, I then joined a startup living in Asia. Was lucky enough to take that startup from $0 to $500 million in the region with our products. We were in almost every cell phone that Samsung or LG made back in the day.
Uh-huh.
And so as I'm approaching this, I think I know stuff, right?
Yeah.
And I'm like, hey, I was an engineer. I didn't get an MBA there, but I took some premier classes there. And then I went to a startup. We grew that from $0 to $500 million. I made a lot of money. I was lucky enough to make a lot of money through that process. And then I moved to another company. Then that company had the opportunity to partner with a fruit company and develop wonderful stuff with them. And then I came here and we're doing self-driving vehicles. I thought I knew stuff. And I was running $1 billion business. I was responsible. I had 1,000 direct reports and 7,000 people in the state of Arizona that I was responsible for. So I'd never actually started my own business. So I didn't really, but you come into it cocky, right? You come into it. Oh yeah, I know what I'm doing, right? All these little kids, they're starting businesses. They're stupid, but I know what I'm doing. Oh man, I am such a better manager today. I'm such a better human today.
Yes. Absolutely.
And the ability.
It'll teach you humility whether you want it or not.
Oh, it is beat into you. And, and I'm so glad that I went through this experience. Today, my pocketbook isn't glad, but in a couple of years, I think it will be.
I think it's going to be too, James. I think it's going to be outstanding. Yeah, I'm watching what you're doing in your business. That's why you're here. I think in the medical space, you're exactly what has to happen if we're going to make the changes that we need. Okay, so let's deal with just average people for a few moments.
Sure.
Do you think that AI technology puts people in mass out of work?
I don't.
Why?
And so this is something that Elon Musk is very famously or infamously, opinion, given his opinion on.
Mhm.
And I look at it as this. In the healthcare industry, if you were going to take the last 2 years and you were going to say, what's wrong with healthcare? I would say it's access.
Mhm.
And I would say everyone would agree that it's access.
Mhm.
Well, why is it access? Staffing shortages,
Mhm.
right? Inefficiencies in the system. So let's say the whole world used AdviNOW. Every doctor can see twice as many patients.
Mhm.
Are we really going to put every doctor out of work?
No way.
No way.
Not even the staff assistants or the other
Not
people.
even the staff
It's just going to
assistants.
become a better experience.
It's just going to become a better experience.
Mhm. And if there is excess money, we'll spend it on electives.
Exactly.
It's not like the money's not going to be there. The fact that we find a more efficient way to deliver the existing system means we open up the door to create a whole bunch of new
Exactly.
systems.
I don't see healthcare as that big threat. Now, I'll
Artificial intelligence, yes.
Yeah.
Uh-huh.
Yeah. I look at it as, I look at Elon, and Elon is one of my heroes, by the way.
I think he's all of
yeah.
he's either everyone's villain or hero, one or the other. Yeah.
Yeah. From an entrepreneur standpoint, he's all in everything he does, and I just love that.
Yep.
Right. And I look at it and I think, and his worry is that with machine learning, we're feeding so much data, where I talked about expert learning and then I talked about, deep learning, and they're different, right? With an expert learning, you're setting up rules and you actually have a human telling the computer what the rules are to follow. And then the computer learns around those rules, kind of like what we do with our children, right? Don't hit your sister, right? No, it's not okay to push her down because she stole your toy, right? You're setting up rules around that intelligence it's learning. What Elon is worried about is deep learning, where we don't give the computer any rules. We just give it a whole bunch of data with desired outcomes. And that type of deep learning is something you should worry about, because ultimately you could have something creating. But the reality is, if you do that, then you're not serving a purpose from a marketability standpoint. And you have to be able to serve that purpose to invest the money to create the AI.
Okay, so you were in automated driving. So how do you deal with this dilemma? I suspect we're going to get to the point where we know, okay, the car's driving itself. It's driving automatically. We just found out that there's an incident in front of us, and we're either going to have to take out a grandmother or a baby.
Sure.
That's the option, right? How is that moral choice decided in deep learning and AI technology? Is there still a person that feeds that in, or does it learn it by themselves?
Those are the rules that are put in.
Okay.
In those type of dilemmas, you would put in rules. So you can say to a computer, I value human life more than anything. And so then you always have the question, you have your kid who's going to get hit by the train, or you take the train off the tracks, right? That's another one of these moral dilemma, wonderful questions that in philosophy class you go through.
Right.
And you'd say, well, take out the train, save my kid, right? And the AI would never make that decision if the rule you put in was number of human lives saved, right? So it's just the rule. It's all about
it's
how
isn't
you're
it funny how
training it.
we're happy to make an unconscious decision that we took out the baby or took out the grandmother, but not to have had a conscious decision up front that said, if it's a choice,
that's right,
which do you pick? And those are hard moral dilemmas, but we're going to have to face those moral dilemmas, which seems to me to say that transparency and openness as these algorithms are being developed is going to become increasingly more important.
But those become just simple rules that anybody can put in. And you could say, hey, Tesla makes a decision to take out the grandma. And BMW makes a decision to take out the baby. Right?
Wow.
It sounds terrible.
Yeah.
But that's just a rule.
Does Moore's Law continue? And Moore's Law, explain to the audience what Moore's Law is and why it's important in AI technology.
Sure. So Moore was one of the early founders of Intel, which is, of course, one of the largest processors in computers, computer processor companies in the world. Well, actually, the largest. What he stated is that every year we're doubling the number of transistors inside a piece of silicon. And in order for that to happen, a lot of different technologies have to evolve.
Mhm.
You have to evolve manufacturing technologies. You have to evolve design technologies. You have to design testing methodologies. There's a massive infrastructure. And so a lot of people said, Moore, you're crazy, right? This is
Mhm.
never going to happen. Ultimately, eventually, we're going to run out of Moore's law for this reason. Oh, we're
Mhm.
going to run into physics problems is always the conversation today, right? And they always find a way around it.
Mhm.
And so how does that affect AI? Well, when you think about, and I'm going to try not to get too technical here, so keep me honest here, Paul, if I start losing the audience. But when you think about what an AI has to consider, right? There's a term that's called classifiers. So if I walk into this room, immediately I'm classifying that little white object over there as a light. Over here, there's a camera.
Mhm.
Here, this is a microphone. I'm walking in, and in my mind, I'm pattern matching. That's called a classifier. A computer can only look at so many classifiers simultaneously because you run out of math. You run out of time. So all of a sudden, it's not real time. And if you give a computer enough time today, then yeah, you could figure out enough things in there. You could have 1,000 classifiers or 100,000 classifiers, and the computer can figure it out.
Because it can store well.
It can store well. Not only can it store well, but it can compute it fast enough.
Mhm.
What's happening today in AI, and NVIDIA kind of leads a lot of the charge on this. So for you gamers out there, you hear about NVIDIA. They are enabling parallel processing and parallel computing at a rate that has never been there in history. And so this is a term that you hear a lot of entrepreneurs talk about as convergence, right? There's converging of AI algorithms combined with computing capability, and that allows higher level intelligence to actually take place.
Mhm.
And in our mind, there's trillions and trillions of computations that happen every second. And we'll reach that capability in silicon, in a not too many years.
Mhm.
So we'll be able to do as many computations.
Yeah, Ray Kurzweil says, what are we, 10 to the 17 bits of information? Computers are about 10 to 12, but he says it overpasses us in about 5 years.
Exactly.
So,
We
and
will
10 years
get there.
after that, it goes past all the human brains combined on the planet, assuming Moore's law and exponential
Continues.
changes happens.
And so what's interesting in Moore's law, and not to get too geeky here, but you start this in a semiconductor is nothing but a switch, right? It's just a switch that turns on and off, on and off, on and off. And then you can abstract that out into very, very complex mathematical formulas. And that's kind of how silicon works. So right now, they're down to one electron turning on and turning off.
Wow.
And the world goes, well, that's the end of Moore's law, right? Hey, there's nothing we can do. We can't put more than one electron, smaller than one electron. What are you going to divide up the electrons, right? Well, now all of a sudden they're doing 3D silicon where they're stacking the transistors on top of each other. So now all of a sudden you've doubled Moore's law. All of a sudden you've solved
How about
that
quantum
next problem.
computing? Does that start to change
Quantum
it also?
computing totally changes the game as well. I would say realistically, that's probably still 5 to 10 years out.
Okay.
But that's when that's how you solve the Moore's law problem. Once you quit stacking up the transistors vertically, which is kind of what's happening now, you then get into really, really interesting areas where instead of a switch being flipped, where it's either on or off, you get a switch that is 1/10 on, 1/20th on. So that same switch now can handle maybe 20 different states. Where it's on sideways, it's half on, or it's 3/4 on, and so that's what quantum computing is all about, is being able to handle essentially an infinite number of states simultaneously.
Well, we're at the end of our time. I've said this to you in the past. If anything ever goes wrong in your company, you should be a professor. I've always enjoyed sitting through my James classes trying to understand it. Good luck with AdviNOW. Although as I said earlier, I believe you guys are the future of healthcare, and you're certainly kind of at the lead end of how AI technology can change it.
Well, we're very excited, and obviously I'm the founder, so in the terms of founders, I drink a lot of Kool-Aid, but ultimately there is no other future for healthcare.
Right.
And it has to go this way. It can't be that doctors have to do all their paperwork at night. It has to be that we free them to spend time with patients. We free them to add the human element to healthcare.
Well, James, that was a wonderful conversation. I definitely enjoyed hearing about AI technology, how this is changing healthcare. I know that if you're a provider in the business today, they're struggling. They're trying to figure out how to make their practices work. They really are living on those margins that you said, 3 to 5%. If someone wants to get a hold of you and your company to see how you might make a difference with them, can you give us an ability to do that?
Yeah, absolutely. Anyone can research about my company just by going to Google and typing AdviNOW, AdviNOW.com. It's AdviNOW Medical. That's kind of where the name came from. Or you can, search for me, James Bates, AdviNOW, and you can link with me on LinkedIn and ask me any questions and reach out. And on our website, you click on the Learn More button. We'll have somebody reach out to you and answer any questions you may have. We would love to support as many people as we can to essentially revolutionize their practice and make it the practice of the future.
Yeah, and that part about getting them to a potential 35% margin has to be something that's more interesting than a 5% margin.
Anyone who actually gets a paycheck, they understand that if they run that business.
Definitely. Thank you, James.
Thank you,
Paul Johnson with the Optimistic American. This is definitely with AI technology and James Bates. Been a fun conversation talking about hope. Thank you. Thanks, James.
All right.
You're awesome.
Thanks, Paul.
That was really
Appreciate
good.
it.